Hi everyone, I'm Dr. Giyaur from New York Laser Vision. Today I want to discuss and explain one of the most advanced options in modern vision correction. That's called ICL, or Implantable Collamer Lens. If you've heard of LASIK but aren't sure what an ICL is, or if you were told that you're not a LASIK candidate, then this video is for you. So what is an ICL? The ICL has been used worldwide for more than 20 years, and it has an excellent safety record. The material, called Collamer, is biocompatible, meaning it works naturally with your eye. Think of it as a permanent contact lens that lives just behind the iris, the color part of your eye, brown or green, and it sits in front of your natural lens. Once it's placed there, you don't feel it, you don't see it, and no one else can see it either. So results are long-lasting, and the lens is designed to stay in your eye for life. But if needed, it can be removed or it can be exchanged if your prescription ever changes significantly. Unlike cataract surgery, we do not remove your natural lens. The Collamer lens, the ICL, goes in front of your natural lens to help you see better. And unlike LASIK, we do not reshape or remove any of your eye tissue, corneal tissue in case of LASIK. The ICL simply adds focusing power inside the eye so you can see clearly without glasses or needing external contacts. So ICL are especially useful and powerful when we're treating nearsightedness, what's called myopia, astigmatism, and especially useful in cases of high prescriptions that are too high or too strong for LASIK or PRK or LASIK. This makes the ICL one of the best options for people with high prescriptions such as -6, -8, -10, or even higher than that. In fact, it can correct levels of nearsightedness that laser procedure cannot safely treat at all. So how does the actual procedure work? The ICL is actually a pretty simple, elegant, quick, and gentle procedure. Here's what happens. A numbing drop is first placed into the eye. No needles, no pain. A tiny self-healing incision is made near the edge of the cornea, so-called limbus. Then the folded ICL is inserted through this micro-incision. And once inside, this ICL lens gently unfolds right behind the iris. It needs to be positioned perfectly, and that's it. The procedure is complete. The incision is so small that stitches are usually not needed. Most patients notice clearer vision very quickly and sometimes immediately, and often within that first post-surgical day. And unlike LASIK, there's no dryness afterwards because the corneal nerves are not affected. We did not touch the cornea with laser. So what are some of the advantages of ICL over other method of vision correction? Why choose ICL? So let's go through some of the biggest benefits. First of all, as I said before, it is really great for high prescriptions. It's the best option for people who are very strongly nearsighted. It can treat numbers that are way higher than what LASIK can treat. Second of all, it's a procedure that preserves tissue. It does not remove any tissue. Your cornea stays completely intact. And it makes ICL excellent for people with thin or maybe irregular cornea that are not perfect shape. It doesn't cause dry eye like LASIK might because we aren't touching the corneal surface. It's a major advantage for people who already have pre-existing dry eye condition. And it is reversible. It's very important for some of my patients to have the procedure that's fully reversible. So in summary, if your prescription is very high, your cornea is too thin for LASIK, you have dry eye, you were told you're not great candidate for LASIK, LASIK, or PRK, and you're looking for a reversible solution, and you're looking for the best night vision possible, ICL is probably a great option for you. LASIK, which we do plenty of at New York Laser Vision, is still an excellent choice for many people, especially those with mild to moderate prescriptions, healthy corneas, those who are farsighted, since ICL cannot be yet done in farsighted people in the United States. At New York Laser Vision, we perform both LASIK and ICL, and we help each patient choose the option that is safest and best for their unique situation and their unique eyes. If you'd like to find out whether you're a good candidate for the ICL procedure, we'd love to meet you. See better, look better, live better. And thanks for watching.